Welcome everybody, and thank you for joining today's webinar on site audits in residential aged care. My name is Tara Pamela and I'm the Executive Director of Engagement, Education and Communications at the Commission, and I'll be chairing today's webinar. Before we get started, I'd like to acknowledge the traditional owners of the lands on which we meet today and pay my respects to elders past, present and emerging. I'd also like to extend that acknowledgement and respect to any Aboriginal and Torres Strait Islander peoples joining us today. We have a number of panellists today to talk to you about site audits in residential aged care. Anthony Speed is the Executive Director for the Quality and Assessment Monitoring Group. Sharon Given is the Senior Director for Accreditation and Performance from the Commission. And Jason Binder is the Managing Director for Respect Aged Care, and he's joining us today to give us a provider's perspective on how they prepare for a site audit from the Commission. Today's webinar is the first in a monthly series that the Commission will be hosting this year, following on from our program last year. Our intention is to host a webinar on the third Tuesday of every month. The day might change in certain months depending on what's happening, but we will keep you posted. The next webinar is scheduled for Tuesday, the 21st of March, and it will be focused on the early lessons learned from the introduction to SIRS in home services. As the full webinar program is finalised, details on the topics and timings, registration links, all of the things that you need to attend will be published on our website. Simply hover over the resources page on the top menu of our website and you'll see a webinars link. That's also where you can go and have a look at the recording of all our webinars to date. Over the course of this year, we'll be focusing on a range of topics. We're also planning to cover topics that the sector's interested, and where appropriate, we'll also hold webinars focused for workers and consumers. So we're really keen to hear from you about what you want to hear more about. As well as the information on the website, we publicise the webinars in our quality bulletin and across our social media channels. So make sure you're signed up to keep up with the latest information. In today's webinar, we're focusing on how the Commission monitors the quality of residential aged services to protect and improve the safety, health, wellbeing and quality of life and people receiving government-funded aged care. This includes our methodology and monitoring of the aged care quality standards, the assessment methodology and what assessors look for when they're going out to do assessments of performance. We'll also look at some of the key risks that quality assessors see when they're completing assessments. And as I said before, we'll also be hearing from Jason Binder, the Managing Director of Respect Aged Care, on what his organisation does at the board, staff and consumer level in preparation for a site audit. Thank you to all of those who've pre-submitted questions. Just a reminder that you can submit questions at any point during the webinar. Just hit the little question mark symbol at the top right hand of your screen. We'll aim to answer as many of these questions as we can in the question and answer session, but if we run out of time, we'll also publish a full range of questions and answers for you on our website. I'd also really like to encourage you to complete the survey for this webinar. We are really keen to hear from you, your feedback on today's webinar, and also the types of topics that you're interested in us covering in future webinars. At the end of today's session, you'll be automatically taken to the feedback survey. It only takes a few minutes to complete, so I really encourage you to do it. You can also, if you want to, complete the survey at any time by clicking on the yellow speech bubble on your screen. I'm now going to hand over to Anthony to start the discussion on site audits in residential aged care. Anthony, over to you.
Thanks, Tara. And today, as you mentioned, we'll talk to the requirements for a site audit, particularly for the purposes of accreditation or reaccreditation. Those requirements are outlined in our Aged Care Quality and Safety Commission Act and the associated rules, and those specify those mandatory requirements which must be followed by both the Commission and by approved providers. A site audit for reaccreditation is assessment of performance against all 42 requirements of the quality standards, and these must be conducted on site. The Commission may conduct an assessment of performance against one or more of the 42 requirements at any other time between a reaccreditation site audit. However, today we'll focus on site audits for the purposes of accreditation, which of course apply to residential aged care. The Commission will conduct an unannounced site audit at any time between the submission of the application and the expiry of the services period of accreditation. And the assessment team will prepare a draft report from that, which is then provided to the approved provider for their comment and input. And following receipt of that provider response, a performance report is prepared for a decision on accreditation or reaccreditation, and of course the period of reaccreditation. And in some cases, the Commission may determine to reduce a period of accreditation. We may determine not to reaccredit a service. And in other circumstances, we may determine to revoke an existing accreditation period. So what is our assessment methodology? Site audits are conducted in line with the requirements of our legislation, as I've mentioned, and these require approved providers of residential aged care to demonstrate their performance against the 42 requirements of the standards. The structure of the quality standards provides a focus on consumer outcomes and considers the evidence of the experience of the consumer and the systems and processes that an organisation has in place to support the provision of that safe quality care and the services. And this is reflected in each of the consumer outcome statements for each of the standards, and of course the linked organisation standard, requirement linked to that standard. So for each of the requirements, the Commission expects the organisation and their workforce to demonstrate that they understand and apply the requirement, that is clear in the way that they provide care and services. And the Commission will assess how the service is reviewing outcomes and adjusting their practices based on their reviews. Our quality assessors are proportionate in how quality standards are applied to different types of services, and we consider how the intent of the standard is applied consistently when deciding whether an organisation meets the requirements of the quality standards. Our requirements for assessment against each standard is outlined in the Guidance and Resources publication, which is on the screen there, and this is available from our website. Further information on our methodology is also outlined in a regulatory bulletin, which we'll refer to later in our presentation. In terms of preparing for a site audit, approved providers are actually encouraged to prepare for a site audit through the application of our self-assessment tool, which is there on your screen and is available as a template with supporting guidance on our website. Self-assessment is an opportunity to support improvement at any time in the accreditation period and provides a useful signpost to the Commission that the service has a culture of continuous improvement that involves consumers and their representatives in planning and delivery of care. A self-assessment is also useful during periods of known heightened risk, such as during labour market pressures, when there's a change in key personnel, or indeed if there are building works underway, to provide the governing body, the senior management, to provide peers and staff with oversight of risk management at that service. And the Commission will seek a copy of the service level self-assessment tool as a point-in-time assessment as part of our application for reaccreditation. Our next slide talks to how we conduct an unannounced site audit. Our rules specify that site audits can only be conducted by registered quality assessors who are appointed by the Commission to an assessment team for the purposes of each site audit. Each assessment team comprises a team leader who is responsible for the conduct of the audit on site. And on entry, the assessment team will explain how the audit will be carried out. They'll talk to the processes for the regular review of the site audit progress during the time on site. They'll talk about arrangements for information gathering, such as availability of documents and records and how to access them. And they'll talk about arrangements for interviews with staff and consumers or their representatives. There'll also be an opportunity during the entry meeting for the person in charge to ask the assessment team questions about the site audit. And importantly, the Commission may conduct a site audit outside of business hours or on weekends. And importantly, all assessors must comply with our mandatory vaccination requirements. So whilst on site, the assessment team collects information to assess the performance against the quality standards that I've mentioned. And information is drawn from 3 potential sources of evidence. And these are around interviews. These are the interviews with consumers or their representatives, with staff, with management, with allied health personnel, and volunteers, suppliers, and contractors. And the team conducts observation to observe staff practices and interactions with consumers, as well as the general living and physical environment. And we'll also look to a document and records review to look at how documents are relaying the assessment practices, the processes and policies on site, and what the service actually does and how it achieves it. And the assessment team must sample sufficient relevant information to provide evidence to support their assessment. The assessment team will also meet with the person in charge on the last day of the site audit to communicate key issues that they have observed and identified during the site audit. And the person in charge may choose to have other people or consumer representatives also attend the exit meeting. Our next slide talks to the approach, and we have an approach which is on your screen there. So against each of the quality standards, we divide into 4 evidence domains. And this is for the purpose of collecting evidence during a site audit with a residential service. So the way that the assessment is conducted differs depending on the evidence domain. And the domain guides us through who is selected for an interview, for the questions asked, the observations made, the documents reviewed, and which types of evidence are pursued in lines of inquiry during the audit. And different types of evidence will assess different questions under each domain. At the entry meeting, the structured questions are asked to assist the team to prepare for the audit, and these are asked to the person in charge, and they focus on areas of known risk, which we develop through the risk-based questionnaire. And these risk-based questions may vary in line with the profile of the service and the information known to us. The assessment team will also request certain key documents during the entry meeting and may request additional information during the course of the audit. Evidence collection is enabled through a sampling approach that is purposeful, and its size will depend on the scope of the assessment against the size and the nature of the service, the composition of the consumer population at the service, and the risks and issues identified in our assessment planning, those opening questions, and our knowledge about risk gathered through consumer interviews. So what are we looking for on site? In assessing the service performance against the quality standards, the assessment team will focus on the intended outcome of the standards in relation to each requirement. And in each instance, the key questions that we ask will informs our focus on the consumer experience of care, and whether the organisation can demonstrate that it understands that requirement in relation to the consumer outcome, and it applies that requirement. And this is clear in the way that it provides the consumer their care and services. The assessment team will also consider the range of evidence sources relevant to the scope of each requirement. And this means that depending on the requirement being assessed, different forms of evidence may be relevant. And the totality of evidence in the context of the consumer outcome will then be considered in reaching a recommendation of whether a quality standard is met. So what are the provider responsibilities here? The Commission will give the approved provider a reminder notice before the end of the service period of accreditation, and usually this is done 6 to 7 months before the accreditation expiry. The rules require approved providers to notify each consumer and their nominated representative at the time of application about the audit process, and again when the assessment team arrives on site to conduct the site audit. This notification requirement extends to appointed advocates or guardians, and reasonable steps must be taken to display the poster that the assessment team gives to the provider, and this poster will inform consumers and their representatives that the audit has commenced. Providers should also enable consumers and their representatives who wish to meet with the assessment team to do so privately, and this includes providing the team with details of consumers and their representatives who may have asked to meet with them. We also appreciate that the audit experience can be challenging, and we take very seriously our responsibility to ensure that quality assessors demonstrate professional behaviours at all times. We also expect that approved providers take responsibility for their own professional behaviours, and Sharan will talk in a moment on our arrangements for feedback. On continuous improvement, I want to focus on the shared responsibilities here. And the Aged Care Quality and Safety Commission rules require that each approved provider must have a written plan for continuous improvement, which demonstrates how undertaking a continuous improvement practice on a site is in place and how it is supporting consumer safety and wellbeing. We've published a template for a plan for continuous improvement on our website, and we encourage approved providers to consider that and apply it. The Commission can request a copy of a plan for continuous improvement at any time, and we may issue a direction to revise a plan for continuous improvement following a site audit or indeed other assessment of performance. As we require of approved providers, we also turn a lens on our own practices, and we implement quality assurance activities which assess consistency of practice across our decisions and across our assessment activities. And these activities include monitoring of data and sampling of reports, and we redirect our training and development efforts in response to identified risks from this activity. And we've also recently undertaken a review of our quality assessment training and development and registration processes to ensure that our practices reflect contemporary processes. Tara, I'll now hand back to you and look forward to our next speakers. Thank you.
Thank you, Anthony. There was a lot of information in that and some great references to some resource tools that I'm sure providers will find very useful, so I encourage you to do that. Now I'd like to introduce Sharan Given, Senior Director for Accreditation and Performance from the Commission. Over to you, Sharan.
Thank you, Tara. I'm going to unpack site audits in a little bit more detail. And firstly, I'll talk about the different types of reports that are prepared. There are actually three main documents that result from a site audit. The first type of document is, as you would be familiar with, the site audit report. This is prepared by the assessment team, and it is given to the provider usually in about a week after the team exit from site. The second type of report is a performance report, and that is prepared by a delegate, and I'll go into a little bit more detail on that one in a moment. The third document that is prepared is a decision on accreditation or a decision on reaccreditation, and that will be prepared by the delegate and include information on whether the service is reaccredited, and if so, what the duration of the accreditation is. So there's an opportunity for you to respond to the site audit report. You will be given 14 days after receiving the site audit report to provide a written response to the contents. Information should be factual and evidence-based, and it is totally at your discretion to provide a response or not. Information that you provide in your response will be considered by the delegate along with the site audit report and any other contemporary information when the delegate is preparing the performance report and also making the accreditation decision. I'll just move on, thank you. So the performance report is a different type of report. The performance report is published and is available on our website. The accreditation decision is also available on our website. This screen shows you how to find a report with a number of different search functions. You can search by provider, by service, by suburb, or by the residential aged care ID if that is known. This is available to everybody publicly on our website, so that includes being available for consumers and the broader public. Moving right along, you may have some questions about the rates of non-compliance. What are our assessment teams detecting? A provider can be found non-compliant with one or more of the quality standards, and this figure in front of you shows that non-compliance was most frequent in relation to Standard 3, which is personal care and clinical care, Standard 8, which is organisational governance, and also Standard 7, human resources. Most instances of non-compliance were due to providers failing to comply with 1, 2 or 3 requirements of the 42 requirements of the relevant standard. These findings in front of you come from our quarterly sector performance report, which is also available on our website. And this data relates to Q1 for this financial year. In a little bit more detail, at the non-compliance at the requirement level, you can see that 3A tends to be the most frequent requirement that is found to be not met. Safe and effective personal and clinical care, closely followed by requirement 8.3C, effective governance systems. So each of the quality standards contain requirements to demonstrate how the quality standard is complied with. Providers are expected to show how their approach enables them to meet requirements at the services they operate. This figure shows the most frequently cited requirements that were found not met within the Q1 of this financial year. The number on the far side, sorry, I'll just move on to the next slide, thank you. The number on the side represents the frequency of the not met finding across the quarter. For requirement 3.3A, the most prevalent occasions of non-compliance identified related to the understanding and interpretation and practice associated with restrictive practices, wound management and pain management. In particular around wound monitoring and the documentation associated with monitoring wound care. In relation to requirement 8.3C, the most frequent findings from our assessment teams relate to inaccurate or inadequate documentation, information management and HR systems. That includes consent and also references to raising incident notifications in a timely manner. In some instances, we have observed services applying a governance framework, however, not having documented the governance framework. I'll move right along to the options to provide feedback. These options are available to all providers, regardless of the visit type. There are 2 main options to provide feedback. The first is completing the feedback survey, and there is a link that is provided to you on departure of the team from the site. When you complete the site feedback survey, you have the option of identifying yourselves or remaining anonymous. Both are completely acceptable, but we do appreciate when you provide your details if you have significant concerns, so that we're able to follow up with you and engage on those issues. The second option is to raise a formal complaint with the Commission, and we have a complaint form that is located on our website. and you can access that and submit it at any time. Complaints regarding the performance or feedback about quality assessors are managed independently from the relevant assessment team or regional team conducting the activity. Thank you. Lastly, as Anthony mentioned, there are a number of regulatory bulletins that are available on our website. Most notably, the regulatory bulletin number 5 details information contained in our presentations today on the assessment methodology. However, there are many other regulatory bulletins available to further detail our assessment approach and the activities, the regulatory activities that we deliver. Thank you very much. Tara, I'll hand back to you.
Thanks, Sharon. Well done, and thank you for sharing those insights. It was really interesting to hear about the things that we see most frequently across the sector. Now, before I introduce the next speaker, just a reminder that you can submit your questions at any time by clicking on the blue hand icon on your screen. So joining us now from a provider perspective, I'm delighted to invite Jason Binder, Managing Director, Respect Aged Care, to share with us what Respect does at the board, staff and consumer level to prepare for a site audit. Over to you, Jason.
Thank you. Welcome everybody. And I'll just give a bit of brief background on Respect. So we have 20 aged care homes. We've got 9 in Tasmania, 8 in Victoria, and 3 in New South Wales. And those homes have joined Respect largely through being in a distressed state. I'd say 90 to 95% of our homes have been in some kind of distress. Sometimes that's clinical. And so I'm coming at this from the perspective of ongoing clinical performance, but there's certainly an aspect of not just clinical performance, accreditation, compliance performance, but there's certainly an aspect of bringing homes that haven't complied significantly and turning those around. Just a quick note before I start. I'm very unwell. I spent the night under a wet towel and fever, so if I'm coughing or anything or whatever, you'll have to excuse me. I'm pretty sure scientifically you can't catch it through the camera, so we should be okay to go. The slide, please. So I'm just going to cover, and the other important thing about this is I'm coming at it from our perspective, and it's just how we deal with it. It's not right or wrong. And I've been invited to this by the Commission, but I'm not representing the Commission either. So it's important just to know this is just from my perspective and Respect's perspective. But this is the compliance environment at the moment, according to us and sort of what's going on out there. And that is that, firstly, it's the unknown timing. So we don't know when assessors are coming. They're just coming. We roughly know when there's a full accreditation, but not, we don't know. The second is legislative changes. We've got heaps of them occurring, increased expectations from the Commission and the government and the community as well. And then we've got risk data. There's a lot more risk data out there. So I'll just cover those 4 points and then what we do about those. So with the unknown timing, we don't know when a visit's going to happen. I don't know if there's people on the webinar, how long people have been in the industry, but it used to be, we used to know exactly when the Commission were coming for a full reaccreditation, and then providers used to rush around for 3 months preparing for the visit to make sure they've got everything covered, and it's just gone in those days. So we need to be prepared all the time. And so what do we do? So we're always compliant and prepared. That's our mentality. We've got to be doing that. It's not just the 3 yearly one. It's the spot visits and things as well. You don't know what they're going to visit, what they're going to check. And so internally, it's just we always need to be compliant and continuously compliant. And that's the mentality that needs to happen internally. And systems over people as well, because you can have people fix a problem. So you might identify there's a risk, might be something like wound. There's too many wounds, and so you can just chuck some registered nurses at that. But it just and fix the actual problem, but it's kind of only temporary. So the way we look at it is we want systems to ensure that it's ongoing compliant, not that we need to have these problems pop up and then throw people at the problem over and over again. But it's important to know, I'm not saying here as well that people aren't important, because the people that deliver the care, and so our people are the most important thing, but they need to work within a system that ensures that we are compliant. The other thing about that is internal audits to identify gaps. So we do those. We like to have them at least 6 monthly. We're doing an internal audit across the 42 outcomes to make sure we can identify where the gaps are. And so we do those. Probably 12 months is probably the longest I'd want to go without doing an internal audit, but we have within our internal systems that we do those every 6 months to identify what areas need to be focused on. And if you're small, because we've got an internal team, because we've got 20 sites, we've got our own auditors, but I'd consider an external audit if you are a smaller organisation, don't have your own internal team to do the audit. I'd consider an external audit, because it's independent as well. Our internal auditors are independent. They're not from the site or anything like that, so it's fresh eyes. And then gap rectification and systems to maintain whatever it is that you uncover. Next slide. So then we've got legislative changes. So we've got increasing and changing legislative requirements in the external environment. Royal Commission happened, as everyone knows. There was 119 recommendations accepted or in principle by the government, and so that means they're rolling out those changes. 50 of those are for providers to implement. So we worked all this out when those recommendations were first accepted. We figured out which recommendations need to be implemented by the providers and which are by other people. So the government need to recommend implement some GPs, allied health, all that. There's other people, but 50 of the 119 are for providers to implement, and it's a huge amount of change, and it's only really just started. Because what we also did is kind of mapped it out to medium to high impact changes. These are changes that we thought would be a medium to high impact on our operations. And so you've got a lot of big changes coming, and so it's really important to have, I'll go to the next slide. And so it's really important to have resources to be able to monitor those changes and implement them properly. I don't think it's reasonable to expect we can have the same amount of staff. I'm not saying throw too much staff at it, but we do need some resources internally to be able to identify the new legislation and put systems in place to cater to it. And so one of the things as well is, like, we expect to be audited on new legislation. So, for example, governance is a new thing that the Commission would be looking at, because the legislation was just passed in December. So it's important to be across that new legislation as it's coming out, because the Commission kind of, and I'm assuming here, they'll be able to say after, but they're going to have a bit of a focus on those things to make sure that the provider is compliant with the new legislation and that we're on the ball. And so then we just continuously monitor. I kind of covered that, and resourcing it, and then update your internal audits. And it's also important to take care of yourself, because there's a lot of change happening in the industry. There's a lot to do, and as leaders, I'm assuming people on this webinar, you're in some kind of leadership capacity. It's important. We're important for the sector as well, and I know there's a lot of talk about staff being important, and they are, like, super important. really important, crucial to the sector, but the leaders who need to implement this change are important as well. So it's important that we take care of ourselves with all those changes, because it can put pressure on us. Increased expectations. So it's a more black and white approach from the Commission, and this is again my experience of it. This isn't coming from the Quality and Safety Commission, even though I'm on that webinar, but my experience is it's more black and white. It's either kind of a met or it's not. There used to be a thing called gaps where the assessors used to come on site, and if there was some things that need adjusting, they'd give you a bit of leeway and kind of say there's a gap there or whatever. We're finding those are just not met now, and that's okay. It's just the expectations have increased due to the Royal Commission, and escalations happen quickly. And so if you might notice, if you sort of start kicking back on things and you've got the wrong attitude, the Quality Commission call that a compliance stance, I think, or posture or something, and it can escalate quite quickly. So those are the things about increased expectations. So what do? We accept the increased expectations. I don't complain about it. So internally, I'm not telling my staff that, oh, the Commission this and that, because they're not fair. And I think that's really important, going back to the previous thing, to take care of yourself, because it's something you can't control. And so if you're always fighting something you can't control, you're just going to cause yourself a lot of stress and tension. So we accept that. It's not that we don't provide feedback through ACPA or directly to the Commission or whatever, but it is just something that's how it is. And so we accept that internally, and you would never hear us complaining about that internally. It's take it seriously, but not personally as well. So particularly for registered nurses, they go to university because they want to care for people, and then they're in the aged care industry. They can end up in management positions, and then if you get it not met, as a registered nurse, it can become, I'm not a registered nurse, but I know because I work with them, that it can become really personal. Like, I have somehow failed the residents, and it's important not to take it personally. It's just that there's some improvement needs to be made if you get not met or other things, and it's not about you personally. And then it's not fighting with the Commission, because if you're not taking it personally, it's easier to just respond and not react, because if you react, it's going to escalate. You're going to be seen as a red flag from the Commission, and they're probably going to escalate it into notices to agree or sanctions or things like that. And I'm not saying to just roll over or be sycophants or anything like that. If there is a case to be had, then just respond rationally and without that emotion. And fights really aren't going to get anywhere with the Commission. And then risk data. So on this one, the Commission has a lot of data now, and they've got that for a reason. They've got complaints, they've got SIRS, they've got infection management when there's a COVID outbreak. They've got the quality indicators, including the new ones coming in July. And the reason they've got all those, I'm assuming, and again, the Commission can answer this if there's time for that, but I'm assuming they're looking at all that data in a bit of a heat map to see which providers are at risk. And if we can go to the next slide, these are all the quality indicators from July 2023. So there's a lot of things there that they can map out on their side to identify where an aged care provider might be at risk. And so it's important to know that they've got all that data, and that's the data they're looking at. Next slide. So what do we do about it? We analyse the same data. So if obviously you're looking at some of that data and you're reporting it and it's out of benchmark and out of whack and a bit high, then that's the focus area you need to focus on to be continuously compliant, like I said in the first slide, because you can assume that the Commission is looking at the same data, and obviously more data than that. You want to be monitoring your staff satisfaction, consumer satisfaction, all those types of things. There's a lot more data that we look at to determine risk, but definitely it's taking some notice of the data that the Commission are looking at makes a lot of sense. We have dashboard reporting, so we've got the data, we can see the high risk areas internally, and then we can do root cause analysis on some things, why it's like that, and then we can systematically address those issues. So we just covered the unknown timing of it, legislative changes, increased expectations, and risk data. Thank you.
Thanks, Jason. Really interesting to hear about all the things you focus on, and I really loved the proactive approaches you have in place to really self-assess your own performance and look for areas that need or that are opportunities for you to improve. So this now brings us to the question and answer session for today's webinar. Before I go to the panel, there is a question that I can answer. So Tim, you've asked, is the session being recorded because you want your team to watch it? Yes, it is. It'll be available on our website later, probably, if not today, tomorrow. Okay, so I'm just going to scroll through to our first question, which I think, Anthony, might be for you. So if the assessors are not in time to reassess a person before they are passing, what is the funding that we're going to get, the minimum amount or the higher amount according to current assessments?
Thanks, Tara. And the question appears to relate to the assessment methodology for the Australian National Aged Care Classification Model. And of course, the ANAC is the funding model, and that provides the subsidies for approved providers based on the type of service and each consumer's care needs. And they're undertaken by an independent assessor, separate from the Quality and Safety Commission. So it's not part of our focus for today, or indeed, as I've said, for the Commission. Thank you.
Thanks, Anthony. This next question I think might be for you, Sharan. So the question is, I'd be interested in the Commission's thoughts about the importance of risk registers at RAC services.
May have different risk management systems and components. Standard 8 requires providers to have systems and practices to help them identify and assess risk to health, safety and wellbeing of consumers. If risks are found, then organisations are expected to find ways to reduce or remove the risks in a time frame that matches the level of risk and how it is affecting consumers. It's expected that organisations have a risk management system that identifies and evaluates incidents and near misses as well. That, of course, extends to the application of a risk register if that's the chosen system in place. Thanks, Tara.
Thank you. Jason, we actually have a question for you from Sarah saying, what IT systems does Respect use to manage, report on risk and their care, and are your care record systems integrated with it?
It's one of those things, the IT systems, there's no ideal solution there with it. We've gone with our risk and data reporting and all the indicators we look at. We've got data analysts internally which grab the data directly from the database. So we use Leacare as our care software. It doesn't actually matter what care software it is, because the purpose of these people, they've got specialist skills in going to the database and getting the data straight out of it and into central database, which then goes to a dashboard. I mean, that's an ideal scenario. If you're smaller, again, it's not easy to do that, but it's definitely a complicated way to do it. There's all talkers from APIs in IT systems and all those types of things. but getting them all to talk and whatever is a difficult task. With our risk register, ours is just Excel at the moment, and that's a more it's not a static document. It does need to be reviewed ongoing, but that's just in Excel. Now data is, like I said, it's in that type of dashboard, but I have seen smaller providers just use Excel with that as well, and it's really about understanding what data it is you want, and we try and look at the leading indicators of things, not the lagging. So leading indicators, something that will kind of predict a result, and the lagging indicator is when the result has already happened and you're looking at it in reverse, trying to figure out how to fix it. But if you've got the data you need, it's probably manual if you're a smaller provider, but for us, because we're larger and we can have that internal resource, we're kind of doing that automatically through back-end systems that we've created ourselves.
Thanks, Jason. Sharon, I think this one's again for you. Can assessors decline to interview a family member or treating doctor who wishes to speak with them?
Thanks, Tara. For site assessments, site audits, our assessment team must interview at least 10% of the consumers on site or their representatives. The assessment team will also interview a wide range of people, including volunteers, management, contract staff, allied health, doctors, and anybody else wishing to speak with them. In some cases, we do have occasions where a very high number of individuals wish to speak with the assessment team, and we may extend the audit time to allow for those extra interviews to take place. And certainly providers are required to support consumers, representative staff and others to be able to participate in the interview process if they choose. Providers also need to communicate that we are on site with consumers and their representatives. There's a form of words that are available, including posters that we provide when the team are on site. Thank you.
Thank you. Anthony, I think this next question might be for you. In terms of clinical education and sufficiency of staff generally, does the Commission have a view on whether training needs to be nationally recognised or not? For example, basic life support, or if non-accredited training is accepted, if the provider can show the adequacy, relevance of the training and its knowledge translation.
Thanks, Tara. The quality standards are outcome focused, and each organisation is responsible for meeting those standards and deciding how they'll do that. We acknowledge that organisations vary in size and structure, and they will have different ways of meeting the standards depending on where they are in the country and what their profile looks like. But importantly, approved providers must show how the approach enables them to meet the requirements of the standards and how they are delivering safe, quality care and services. And this includes around the education and training of their workforce. So, for example, Standard 7 requires providers to demonstrate that their workforce is competent, trained and equipped to deliver safe, quality care. And Standard 8 requires providers to have those workforce governance systems and processes in place which ensures that workforce are practicing consistent with regulatory requirements. And importantly, we look at training courses such as infection prevention and control training being completed by designated nursing staff. And this would be a regulatory requirement would look to. So in short, we do not dictate the requirements for nationally recognised or not. We look to the outcome and the compliance with the standard. And whilst not mandatory training, we have on our website a range of education resources, some of which we've talked to today, but also information and workshops available that are available specifically to assist providers to achieve that quality care and continuous learning. Thanks, Tara.
And Anthony, just sticking with you while your mic's open, the next question is, I'd love to hear you touch base on some of the best practice you see in managing risk regarding behaviours of concern and team member approaches with residents who are on behaviour support plans.
Thank you. Look, the important elements here are about that person-centred, individualised prevention and management of behaviours. And this includes gathering information about the person from the individual, from their regular or current staff who care for them, importantly, of course, from their family and friends or representatives, and any professionals and allied health staff providing that care. The information gathering relating to that consumer care should include, but is not confined to, understanding the person, understanding their personality, their beliefs and attitudes, their background, including a trauma background if that's relevant, and any other significant life challenges that they've faced. And we must also understand the things that have been particularly important to that person, that directs their behaviour. For example, what appears to have caused or triggered it at different times, at times of the day. Is the environment different? And is this relate to sounds, to lighting, to people nearby? And we must understand whether the person has any unmet needs around comfort, around temperature, environment, or so on. Importantly, we must assess the risks. We keep coming back to understanding what risk of harm is there to the individual or to others if that the behaviour is posing. And is there a risk? Is it actually a problem? That's a question to ask ourselves as well. And how can those risks be modified or removed if they exist, for example, in relation to physical danger or psychological harm? It's also important to understand the options available to management to try to get an idea from the person themselves about what might help, and document those strategies and have them available, particularly if they're known to have worked in the past. We have information on our website about behaviour support plan resources, and Dementia Support Australia also has some good resources that are available for use. Where we see not so good practice, we see that behaviour support plans are insufficient or they don't provide that cohesive approach that I've just outlined, or they're commonly found to only include generic strategies and cut and paste strategies from drop-down boxes, for example. And these are not considered best practice behaviours. They're not person-centred, and they do not consider the individual's background. And so any generic strategy needs to have an underpinning assessment of that individual's preferences. And we also see regularly that behaviour support plans are not being reviewed regularly. So on a basis of reflecting changing need, it's important to have those plans reviewed on a frequent basis to reflect individual circumstances. Thanks, Tara.
Thanks, Anthony. Next question, I think, Sharon, might be for you. Can we have consistent tools for what is expected in the first hour of a visit as supporting evidence, because there are a variety of documents that are given to each centre? And also, could the link be shared that the provider should be using for responses to evidence as evidence to support its often large files, and they mean multiple emails? Again, there appears to be inconsistency depending on the case manager's preference.
Sure, thanks, Tara. Two parts to that. The first part, every site audit begins with an entry meeting between the person in charge and the assessment team. In that entry meeting, the assessment team will ask a series of what we call risk-based questions and seek critical documents to be able to begin with the assessment approach. A copy of the risk-based questions and a list of documents is available on our website. So Tara, we could include that in the package that's available for participants afterwards, directing where to go to find that information. Of course, we may have practice variation. We're not perfect, of course, and we continue to work with our assessors to standardise consistency across our work, as Anthony had mentioned earlier. That includes supporting our newer assessors to apply practices consistently from the beginning. The second part of the question was a link. At the moment, the Commission doesn't have a portal to receive information from providers. So generally, that's done via email, or in some cases, providers share the login details with assessors to be able to use their software whilst on site. But at present, there isn't currently a portal available to supply information. Thank you.
Great. We probably only have time for one last question. So Jason, it's actually another one for you from Louise. I'm interested in external auditors to review our practice and systems against the standards. I know you can't advertise a group or company, but any advice that you can offer, Louise?
Yeah, it's hard because I can't recommend anyone on here, but if people want to find me on LinkedIn, I'm happy to just connect me on there. I'm happy to answer any questions, or email me, jason.binder@respect.com.au. I'm happy to answer any questions, because like I said before, it is a tough time for the industry, and I think we all need to stick together. So I'm more than happy to talk to other providers and help. We're not a closed off provider. We're quite open to helping other people. So please, anyone, feel free to contact me anytime if you do have questions like that.
Thanks so much, Jason, and that's a really generous offer that I'm sure will see your inbox rapidly build. So that's all we have time for in today's webinar. So I wanted to say thank you all again for attending, and thank you for submitting your questions. As I mentioned earlier, there is a feedback survey that will pop up on your screen as soon as the cameras are turned off. If you haven't already completed it, please do so. We are genuinely interested in what you think of these, your feedback, and other things that you'd like us to discuss with you. If we didn't get to answer your question today, we will make sure the Q&A is made available on our website following the session. Thank you very much to Anthony, Sharon, and especially Jason, who's joined us on his sick bed, for joining us and sharing your perspectives and your time so generously. Again, don't forget to sign up for our social media channels if you aren't already, and that will be a great way for you to keep up to date on things that are happening in the Commission. Our next webinar, just a reminder again, Tuesday 21st of March, early lessons learned from SIRS in home services. So registration details will be coming out in the Quality Bulletin and socials soon. If you're not already a subscriber to the Quality Bulletin, I encourage you to do so. There's a subscribe button at the bottom of every single page on the Commission's website, so pretty easy for you to find that. If you'd like to find out what other topics we'll be covering in future sessions, you can find our webinar program by hovering over resources on the website, and you'll see the link to webinars. And again, that is where you'll find all the recordings of all of our webinars, including today's. Thank you and have a great day.